Dizziness is really common symptom in clinical practice, and there is a wide variety of reasons behind it, such as issues with the cervical spine. How exactly can cervical spine cause dizziness, and what should be done for this challenge? If you are interested in the topic, this is the video definitely for you. Let's start with the basics of the balance. When it comes to the maintaining of the posture, we need a lot of information from our eyes, the balance organs in our ears, and the proprioceptic structures in our body. Through this information, the brain forms the picture how and where are we in space. 7 vertebrae of the cervical spine are supported highly sophisticated network of muscles and tendons which work in harmony to provide support and facilitate movement. Partially, the suboccipital muscles located right at the upper neck area contains incredibly high number of the different receptors compared to, for example, low back muscles. These receptors provide the brain with information about things like joint angles, the range of motion of the muscles, and amount of the muscle strain, which is then combined with the information received from the eyes and the balance organs in our ears. When everything is working properly, we can maintain good balance, posture, and coordinate movements. However, if the receptors continuously provide abnormal information, then the brain's interpretation how we are positioned in space may start to change. Here is an example from the hawk. Think about how precise the head stays in place even though the hawk body moves in different motions. It's stunningly sophisticated complex system. However, if there is a disturbance in the system, then the person might start feeling symptoms like dizziness or imbalance or difficulty to coordinate the movements. And this can sometimes have a huge impact in individuals' quality of life. When interviewing the client, it's important to gather key information about the onset, duration, and nature of the dizziness. Additionally, it's crucial to know if the client has had any injuries on the background or previous issues with the cervical spine. During the physical examination, we try to find restrictions or dysfunctions in the musculoskeletal system that might be contributing to the client's symptoms, especially examining for the tender structures, limited range of motion, and muscle weakness. With the manual examination, we also get better picture about overall situation. After that, the sensomotoric test determine how well the client can perform movements and maintain their balance. How then or with what test can cervical vertigo can be differentiated, for example, benign positional vertigo. The best differentiating test for the benign positional vertigo are Dix-Hallpike test and supine head roll. More information about the benign positional vertigo can be found in the card at the top, and there is a link also in the video description down below. If you have ever experienced intensive dizziness or the stiffness in the upper neck area, definitely comment down below. And if you want to have more information related to ergonomics and health in the future, be sure to subscribe to the channel. And definitely share the link with your friends if they are facing similar challenges. So what are good tests for diagnosing dizziness originating from cervical spine after the interview and manual examination? According to 2014 article, cervical spine-related dizziness and benign positional vertigo can be differentiated using the cervical joint position error test and the cervical torsion test. In the study, patients with the cervical spine-related dizziness felt more drowsiness or lightheadedness, had more tenderness in the upper neck area, and made more errors in GPE test. 2022 article also strongly supports the cervical torsion test and suggests that manual therapy is very effective treatment for the cervical spine related dizziness, but it should also accompanied by the exercises. If you want to see video about cervical joint position error test or cervical torsion test, definitely leave a comment down below. Try this interesting thing as well. Adopt upright posture and place the finger to the midline of the head. Go downwards until you reach the upper neck area. From there, move a bit laterally towards the ear and keep your finger in there. Then close your eyes, start moving your eyes up and down, side to side, and even make circles clockwise or counterclockwise. Do you feel any tension in the finger when you are moving your eyes when they are closed? When you should seek medical attention if, addition to dizziness, you start experiencing other symptoms. Here are 7 D2 and symptoms that might guide the situation. So if you are having symptoms including, but not limited to, sudden loss of the consciousness, double vision, swallowing disorders, speech protrusion disorders, abnormal touch of the sensation in the face area, shortness of the breath, eye flutter, and nausea, it might be time to see the doctor. The first D stands for dizziness, and I wouldn't necessarily turn into the doctor if the severity of the symptoms can be reduced. However, if the symptoms suddenly starts to increase, the only place is to be at the doctor's office. What does the physiotherapy for the client with the cervical spine related dizziness look like? It can include manual techniques, mobilization or manipulation, aiming to increase the range of motion in the poorly moving structures. This might involve reducing the muscle tightness to alleviate the pain or help the muscles to relax if they have been tight grip for a long time. Training proprioceptics is extremely important, allowing the client to more precisely control neck movement. If you are suffering from this issue, go to the healthcare professional who understands and can manually examine the cervical spine. If you are looking for the tips how to relieve upper neck muscle tightness, here is a video for you. You can also find benign positional vertigo on the health playlist, so definitely it's worth checking out too. Thank you very much for your time and see you at the next one.